The coronavirus pandemic is being blamed on a 26% rise in alcohol-related deaths. That's according to new data from the CDC.
As CBS 2's Michael George reports, it's the highest rate recorded in at least 40 years.
1 year ago, doctors weren't sure Brandon Ballantyne would survive. The 29-year-old had been diagnosed with cirrhosis and was in liver failure.
I was told that I almost lost my life in there twice.
After 15 days in the hospital, Ballantyne was able to get back on his feet and into rehab for the alcohol use disorder that nearly killed him.
It's just as addicting as any other substance, and I can say that because I've tried other substances.
According to new data from the CDC, the number of deaths that can be directly attributed to alcohol skyrocketed from 39,000 in 2019 to more than 52,000 last year. David Jernigan of the Boston University School of Public Health says the rise is linked to the pandemic.
We've just been seeing people are drinking at home a lot more. They're drinking in unsupervised situations. The stress, the mental health issues that have come up during the pandemic.
A second report from the CDC published earlier this week looked at a wider range of deaths that can be linked to alcohol use, including car accidents, suicides, and cancers. The study found as many as 1 in 8 U.S. adult deaths fall into these categories, and experts say this loss of life is often preventable.
There's not nearly as much attention to alcohol, and yet this study shows that alcohol is taking a toll larger than that of opioids.
The CDC is recommending an increase in taxes on alcohol and to decrease the number of places it can be sold.
Alcohol is almost scarier than most other things just because how easy it is to get and how cheap it is.
Ballantyne is now 1 year sober and hopes sharing his story will save someone else's life. Michael George, CBS News, New York.